Hi friends. As most of you know, my wife and I have been missionaries in El Salvador for the past 6 years. We often go to this little island called La Casada. It's a forgotten island. Even the people of El Salvador don't know where it is. But these people are wonderful people. They have very little. They have no medical help whatsoever before we came. They had no doctors, nurses, paramedics, midwives, or anything like that. So we've been going there for a number of years. We take a lot of medications with us. We often see 1,000 patients in a week when we go there. And it often becomes very clear to me that we don't have the things that we take for granted here in this country. We don't have any x-rays. We have no MRI scanners. We have no CT scanners. And sometimes these things would really, really help. I remember last year I went to see a man in the middle of the night. They called me that he was maybe dying. He was having horrible abdominal pain. So they took me to his place on a motorcycle about a couple miles away. I got there, he was laying in his little hammock and he was moaning with pain, and he said, he was 85 years old, he said, "I think I'm dying." And so I examined him, and it was really tough. In the middle of the night, feeling his stomach, listening with my stethoscope, trying to find out what was wrong with this guy. And of course, no help on the island whatsoever. So I went back to the clinic and I pulled some medicine. I thought it might help him. I gave him some different medicines and a shot and so on. And if I had only had a sonogram, that would really, really help. Sonograms usually cost $50,000 or more. The price has come down for a great sonogram now to about $4,000. And it can be read on your iPhone. And it's amazing what you can do. And if I'd had a sonogram that night, I could have checked to see if he had gallstones, if he had a ruptured aortic aneurysm, if he had ulcers that had perforated or anything like that. But I had nothing, so I just had to treat him by the seat of my pants. Fortunately, the next morning when I was eating breakfast, he showed up. He walked all the way to see me, and he said, "My pain is gone, thank you, my pain is better." So we thank God for that. But every time we're there, we could use the sonogram, and our doctors that are there could use the sonogram. So I'm asking you to be missionaries with me this time. Contribute to raise this $4,000 so we can buy this machinery that we can take with us on our next trip. And I really thank you for your consideration. I thank you, and God bless you.